The need for health care cannot start too early for newborns and new moms. Mental and physical well-being for newborns and their mothers can have a huge impact on a baby's growth and development. That's why I introduced AB 608. AB 608 would expand a mother's access to perinatal health workers who screen for postpartum depression, help with child nutrition, and provide a warm handoff to a host of other social services.
California has a legacy of leading and expanding coverage to our most vulnerable Californians. And yet, I must admit that our work is not done. We've enrolled 304,000 individuals into Medi-Cal since May 1st through the advocacy of our combined efforts. But our work is not done. We must also make sure that we're addressing the affordability concerns for our most vulnerable populations.
Durable medical equipment, like a manual wheelchair meant for everyday use, typically costs $3,000 to $5,000. And sometimes a powered wheelchair could cost as much as $50,000. And yet, folks with these disabilities aren't able to purchase them. And in the fourth largest economy, they're having to use used equipment that is not made for their issues. And that is why my bill will make sure that private insurers and Medi-Cal covers these essential devices. No one in the state of California should be suffering from the need to access health care.
Some of you may not know that I worked over 30 years in the ambulance industry. I look back at those years that probably less than half of those patients I would transport to the hospital didn't have any insurance, right? For a number of reasons. Fast forward to now, what we're doing year after year is starting to close that gap to make sure healthcare is more affordable and accessible for all of us here in California.
And I'm proud to be here with my colleagues, standing with this group that gets things done for our community and talking about the work that we're doing this year to ensure we truly have a California for all. Only about 20% of young people receiving Medi-Cal get screened, but we know that the need is much higher. It starts with ourselves, our parents, our grandparents, in acknowledging the trauma our families have lived through and recognizing that there is a big difference in surviving and living.
Equitable and affordable healthcare coverage is personal to me. My daughter had to take an emergency trip to the hospital, and I received a bill for, let me just tell you, a very surprising amount, despite the trip being medically necessary. The last thing anybody should be concerned about is being able to pay and afford for the bill for transport. It can be financially destabilizing, especially for low and moderate income Californians who lack significant savings. Some may not even call 911 for legitimate fear of the bill, putting their own health at risk or those they love.
While expanding the services of the state healthcare system and Medi-Cal, we also know that for many in covered California, deductibles and co-payments are enough for some to avoid seeking care. This is especially true for the thousands who cannot afford the cost of an unexpected medical emergency, let alone preventative care. Removing this cost barrier means more can seek out care without worrying whether they will be unable to pay for gas, rent, or balance their family budgets.